Welcome to the last part of this module. In this presentation, we will discuss the muscles of the pelvic limb. Just like the thoracic limb, the muscles of the pelvic limb can be grouped based on the joints they are acting with. These are the muscles that are acting on the hip joint, stifle, hock, and the digits. Likewise, they can be further grouped as extensors, flexors, adductors, or abductors depending on their main action. Let us first discuss the muscles acting on the hip joint. The hamstring muscles are the chief extensors of the hip. This is a group of muscles composed of the biceps femoris, semitendinosus, and semimembranosus. The biceps femoris is the most lateral of the caudal muscles of the thigh. To see the other hamstring muscles, we need to remove the biceps femoris. This is the semitendinosus, the middle muscle of the caudal group. On the other hand, this is the semimembranosus, the most medial muscle among the three. Let us have a caudal view of the thigh muscles to visualize better the hamstring muscle. Other extensors of the hip is the medial gluteal muscle. Here is a dorsal view of the loin area of the animal where the gluteal muscles are located. For orientation purposes, this is the biceps femoris, and here is the medial gluteal muscle. This is another strong extensor of the hip. Since we are already discussing the gluteal muscles, let us then proceed to the abductors of the hip. First is the superficial gluteal muscle. This extends from the sacral vertebral spines to the third trochanter just distal to the greater trochanter. Considerably, this is a weak muscle in domestic animals. The next gluteal muscle can be revealed once we dissect the middle gluteal muscle as shown here. This is the deep gluteal muscle. It extends from the spine of the ischium laterally over the hip joint to insert on the greater trochanter. Also part of the adductors of the hip is the tensor fascia latae. It is a strong, fan-shaped pyramid which extends from the tubercocci to the lateral femoral fascia. It attaches to the patella. In addition to abducting the hip joint, this muscle flexes the hip joint and also extends the stifle. Next are the adductors and the rotators of the hip joint. Here is a medial view of the hip and thigh muscles. The first adductor is the gracilis. This is the most medial muscle extending from the symphysis of the pelvis to the tibia. Next is the pectineus. This is a small spindle-shaped muscle deep to the gracilis. It is both an adductor and a flexor of the hip. Adductor is the largest muscle on the medial side of the thigh. If we remove the gracilis, we can see the extent of the adductor muscle. It extends from the ventral aspect of the pelvis to the medial side of the femur and tibia. It is a strong adductor but may also help to extend the hip. It is divided into a bigger adductor magnus and a smaller adductor longus. If we remove the adductor muscle, the quadratus femoris can be seen. This is also an adductor of the thigh. Several other small muscles in the deep layer of the hip musculature extending from the area of the obturator foramen are outward rotators of the thigh. They include the internal and external obturator muscles and the gemini. Let us then discuss the flexors of the hip. Here is another medial view of the thigh muscles. One of the known flexors is the sartorius. It is a thin, strap-like muscle that extends from the tubercocci to the tibia, diagonally crossing the medial surface of the thigh. It is divided into two distinct parts in dogs, the sartorius cranialis and the sartorius caudalis. Here is the sartorius muscle seen at the lateral view of the upper pelvic limb. Another flexor is the iliopsoas muscle. If we performed a deeper dissection of the medial thigh muscle, Close to the quadratus femoris is the iliopsoas muscle. This is the strongest muscle of the pelvic girdle. It is formed by the union of the iliacus and the psoas major muscles. Now let us move to the muscles acting on the stifle. For the extensors, we have the quadriceps femoris. Take note that this is different from the previously discussed quadratus femoris. Here is a lateral view of the thigh muscles. For orientation purposes, here is the biceps femoris and here is the fascia lata. If we remove the fascia lata, we can then see the quadriceps femoris. This is one large muscle and is the primary extensor of the stifle. From the name itself, this muscle has 4 heads. Their distinct origins and clearly distinguishable muscle bellies make it a common practice to name them as separate muscles. All 4 heads insert on the patella. From this view, we can see 2 of the 4 heads. One is the vastus lateralis. This originates in the lateral shaft of the femur. And also, we can see the rectus femoris. If we remove the vastus lateralis, we can see a bigger picture of the rectus femoris. This is the strongest and longest of the 4 heads. It originates from the ilium just above the acetabulum. Also, we can see here the vastus intermedius. It originates in between the medial and lateral shaft of the femur. The 4th head is the vastus medialis. It originates from the medial shaft of the femur. The chief flexors of the stifle are the hamstring muscles, which also extend the hip as we discussed. In addition, the extensor muscles of the hock that originate on the caudal surface of the distal end of the femur may also flex the stifle. This includes the gastrocnemius and the superficial digital flexor. Aside from that, the popliteus is a relatively small muscle caudal to the stifle. Its chief action is the flexion of the stifle, although it may slightly rotate the leg medially. Now let's move on the muscles acting on the hock. Here are the different views of the musculature of the leg and the digits, and here is the hock. Acting on the hock as an extensor is the gastrocnemius. This muscle forms the largest bulge of the caudal crus. This is the most superficial muscles in the caudal crus and is comprised of a medial and a lateral head. The tendons of the gastrocnemius and the superficial digital flexor make up the bulk of the common calcanean tendon or the tendon of Achilles. For the flexors, we have here the tibialis cranialis. It is the most superficial muscle of the cranial crural surface and is fleshy throughout most of its length. The peroneus longus or the fibularis longus is located just cranial to the fibula. It acts to pronate the foot. A deeper dissection is needed to show the peroneus brevis or the fibularis brevis. It has short fibers, implying to its name brevis means short, that remain closely applied to the lateral tibial and fibular surfaces. This muscle is found only in carnivores and is a weak muscle. Finally, let us discuss the muscles acting on the digit of the pelvic limb. Extensors of the digit include the long digital extensor and the lateral digital extensor located deep to the long digital extensor and the peroneus longus. In this picture, only the tendons can be seen. There are 2 flexor muscles acting on the digit. Again, on this muscle of the leg and the digit, we need to remove the big superficial muscles like the gastrocnemius. After that, we can expose the superficial digital flexor muscle. This is a spindle-shaped muscle sandwiched between the 2 heads of the gastrocnemius superficially and the popliteus and deep digital flexor muscle deeply. Owing to the shared point of origin, much of the proximal part is fused with the lateral head of the gastrocnemius. On the other hand, the deep digital flexor lies against the caudal tibial surface. And that concludes our discussion on myology. Take note that we discussed only the common muscles and just provided you an idea on where they are located. Again, please bear in mind the action of each muscle is not exclusive to a particular joint. We just highlighted the most common action of such muscle. If you are ready, you can now take the short assessment prepared for Part 3 or the muscles of the thoracic limb and Part 4 or the muscles of the pelvic limb.